Of course, the basic theory of Ayurveda is based on Vata Pita Kabha, no change. That is the basic concept. Not we cannot say it is a factor or as an element or say a thing like that. It is a concept. Everything in this world, not only in this world, we can see in the universe or whatever it may be, can be divided into two. That is the basic classification. Just like we say, everything in this world can be divided into two, living and non-living. It starts from that. It doesn't mean that only two types. No, it is not like that. Then comes the classification and the subdivisions like that it goes. And we know there is not two persons similar in this world till that time. But all are having 2 eyes and 2 ears and 2 fingers, 10 fingers and like that. But that remaining all this same, the patients are varying. That means crores and crores of people are having different shapes and different format and their body codes. Everything is changing. Remaining these basic concepts same. Just like that, hair, then ear, then forehead, it is same. But the changes are within that, changes are coming. Just like that, we are constantly keeping the theory Vata Pita Kabha. Then comes its subdivisions, classifications, subdivisions and varieties like, then combinations. Then it becomes crores and crores and can be changed. Because these variations can be seen in each organ, each anatomical structure. Then see how much variations it can be. And each dosha has its own properties. For example, Vada, Rucha, Leghu, Shidha, Gara, Sushma, Chala, like that. There are very strict properties. And these properties, we have to find out this ratio of these properties in each organ, in each structure. For example, I will say the first property of Vada, which is very familiar, that is, we say Rucha. Rucha means, we can say different meanings, maybe roughness, something like that, or dryness. I think you follow the meaning. It is something like roughness or dryness, everything comes under this term Rucha. Then, what is the nature of this Rucha in each organ and each anatomical structure of our body? What is the Rucha of hair? What is the Rucha nature of our forehead? Then what is the Rucha nature of our eyes? Then like that it varies from person to person and from time to time. But the term Rucha remains. And the basic reason for that Rucha, that is the decreased quality of Vata, also remains same. But the symptoms changes, the signs changes. Then on that particular term itself, it becomes thousands and thousands of variation. That is the principle. But just like we say, all are living creatures, from amoeba to dinosaur. This living creatures. Like that, Vata is same, and the Rucha also is same. But the nature varies from person to person, from one place to another place. The Rucha nature of the person who is living in the seashore may be different from that of a person who is living in a hilly area. But the dryness or roughness, that nature is same. The patient will say there is dryness to me, but the symptom will be varied. There will be cracking, that also a symptom. There will be some disconnecting of the skin or peeling of this all comes under the same. And that is different from the hair to the eye. What is the dryness in the eye? What is the dryness of the skin? What is the dryness of the leg? What is the dryness of this nail? These are all different. But a person can understand there is dryness. Got it? So there will be some. This is only very simple thing. Then what about inside our body? This is only external things. From each point of our body, we have to identify what is the symptom of this dryness. Then you just imagine. Then what will the combination of 3? Then one more thing will come to the picture. This is, I told you, Vata Pita Kabha is only a concept and it is not visible. That is another thing. This materialized body is made up of 7 dhadus. Rasa, Rakta, Mamsa, Medas, Asti, Majja, then Shukla. And this is our body. The mass is made of it. So, we can identify, we can understand the role of this Vata, Pitta and Kabha by the action of these dhadus only. That means doshas are acting on these dhatus. So, when our body became, when our bone, that is dominant of Asti dhatu. When there is one change in that dhatu, we can understand what is happening to the functioning factor of that dhatu, whether it is Vata, Pitta or Kabha. So, we have to identify the vitiated dosha from the signs and symptoms that is developed on these dhatus. Then the picture again changes. The number increases, then multiplied numbers are coming. Like that, we cannot, the number of this disease is endless. It cannot be counted, it cannot be limited. That is the actual picture.